You'll remember back in early January we were going to go ahead with this demonstration, and obviously it was we had to stop due to public health concerns over the rise of Omicron COVID at the time. Thankfully we are past that wave. We did see some initial improvements in terms of industrial relations within the GHA and other areas. Unfortunately, that has now seemed to surpass, and we feel that we're somewhat back to square one in terms of some of the key issues. Those issues being the issues of insecure contracts across the sector, issues of departmental concerns not being addressed, issues stagnating for significant amounts of time, and frankly members across the health and care sector have had enough. And that's why on Tuesday the 29th of March we'll be gathering at Casemates Square at 5 p.m. and be marching from Casemates Square up to number 6 Convent Place. Health and care workers have gone through an enormous and difficult period through COVID, and they're finding a situation where their various employers, whether it be through the GHA care agency and even private areas of the health and care sector, are not giving them the respect and dignity they deserve in the workplace, and they feel neglected, they feel they're not being listened to, and this is why we are entering into this demonstration on that date. And hopefully we can try and get some agreements and actually better ways of working forward, because frankly the state of affairs now is completely unacceptable.
You've highlighted what you say are rumours that the GHA also plans to cut relief cover for nurses and force them to take their extra days. What does this mean, and why does Unite believe there's weight to these rumours?
Well, we've had it raised to us by a number of our members within nursing. It's one of those ones where I think the concerns we have is that this will put enormous strain on a workforce that again has gone through the biggest health pandemic in living memory, and also frankly it's going through systematic change within the organisation, and it's going to drastically affect staff when there is already incredibly low morale in the organisation. It's almost a kick in the teeth to staff who give their all day in day out, and the concerns we have. The nursing block is the biggest block in the organisation. These changes could be incredibly dangerous, not just for them as staff, but even potentially for patients. And we said very clearly yesterday that this could bring staff to the brink. And also we're deeply concerned in the way we've had to find out about this. We found this out through our membership informing us that they're hearing changes that could be potentially taking place. Yet it seems to be, these decisions should be part of a consultation process, and yet we're finding out essentially through secondary sources. And even to this date, we put urgent questions to the GHA and no responses. So are you hiding something? Are you just not willing to listen anymore? And it's very disappointing.
In addition to this upcoming demonstration, Unite has also threatened escalation of industrial action over the reinstatement of Dr. Casaglia as medical director. By threatening escalation over the appointment of an individual who's been legally cleared, isn't Unite attempting to exert the same interference over appointments as it says the government does, and effectively holding the GHA hostage?
I don't think it's as clear cut as that. I think we need to remember, this issue has been incredibly dealt with badly by the employer. And many of our press statement went very much against how the GHA has handled this state of affairs. We have a situation where the judgment was quite clear that there was a finding of fact in terms of the incident that took place. Now, a disciplinary process has taken place. We've been very disappointed with that result and how that conduct, carried out with the result. But we have a situation where there have been a number of concerns that were raised over a significant amount of time in terms of how managerially things were being dealt with. I think as an organisation, this has been an issue that has been felt deeply by the membership. But again, when we have our demonstration on the 29th of March, this is an issue that's felt by the membership, but also we have many issues that have been not being addressed. And I think what we're gathering across the health and care membership is a feeling of great desperation, great frustration on many issues, and for a certain element of our membership, that this is another one as well.